Hi guys, this is Fernando doing another video for the Modern Survivalists. In this case I'm going to be doing another video on what happens when you get shot. I got very good feedback on the previous two I did. I think they went pretty well, but there's a couple of things I still want to mention about it. About what happens when you get shot, some little things that I couldn't manage to include in previous ones. Some folks also suggested doing one on what happens when you get cut or stabbed, referring to blades and wounds and such. So that's probably going to be a video that I'm going to be making sometime later on. So right now I just wanted to finish with a couple of concepts that were left uncovered in the previous video. Recapping a little bit, we talked about what happens, the reactions you can come to expect from people, and generally speaking, people don't even realize when they've been shot. When you talk with guys that have been wounded with firearms, many times, especially when it's handguns, and especially when it's not hitting any vitals or any main arteries or nerves or anything that will have an immediate reaction, most often they tell you that they didn't even notice they've been shot. Right? In the middle of the fight, especially if they are in the fight mentally speaking, they don't notice it. Some mention that they feel a sting. We have to differentiate here between handguns and rifles, right? Especially with handguns, that's the reaction, not even realizing they've been wounded. With rifles sometimes, or with big bore handguns, especially something like 45 ACP, 40 Smith & Wesson with the magnums and such, sometimes they say that they feel they've been punched, you know? The person tells you that he felt a punch somewhere in the body, especially with more powerful handguns and mostly with rifles. If a vital has been hit, if there's quick internal bleeding and the pressure is dropping fast, if there was something that compromises the person in some other way and he's not able to function anymore and he goes down, usually they sort of collapse forwards or backwards or to the sides, depending on how they were moving at the time they got shot. So when you see the films, or you see the films and they just fall as a puppet that got the strings cut, or they fall forwards or backwards, and they start making some of those guttural sounds I mentioned before. Or one person that I talked to, he said that he just fell without even realizing why. He just fell after being shot with an AK-47. So those are the things that I talked about in the previous two. Now, another important difference between handguns and rifles, and this is something that I got mostly from medical manuals and such. They mostly differentiate these two depending on the type of wound. If it's a wound caused by a handgun or a rifle, a high-powered rifle, as they sometimes refer to. By that, they are meaning a projectile that is going pretty much very fast, about 2,000 feet per second, give or take. Those are the speeds which make a difference between the wounds you're talking about. Let's suppose this is an arm, right? We have bone here as well. You guys see that? Yeah. And you have the chest over here, and here's the collarbone. Well, here's the bone of the shoulder, and we have, the flesh, the meat. What do we have here? We have the flesh and we have the bone. If we're talking about a handgun, the projectile comes in, impacts, and the chances are that it may or may not fracture that bone. What are they going to be doing in medical terms? First, cleaning the wound, disinfecting it, removing whatever needs to be removed, and regarding the fracture, they're going to be treating it as a normal fracture. Just going to be putting a casket if it's necessary. In most cases, that's what they're going to be doing with a handgun. That's what the manual says for these guys. Let me just put it in there. I'm not a doctor, I'm not a medical specialist. This is just what I've read that is recommended in these cases. So they treat it as a puncture wound, they treat the hemorrhage if it's bleeding, and regarding the bone, they just treat it as an ordinary fracture. Now, the difference with the rifles is that when the rifle hits, this is going to be the rifle, right? Making a little AK over here. Okay, when the rifle projectile hits, it's not just gonna be breaking, it's gonna be shattering completely and sending secondary projectiles of the bone, maybe also the projectile itself shattering into pieces, but mostly the matter of the bone just blasting through it and causing it to work as secondary projectiles, the bone itself. This sort of wound is much more dramatic, and if you see pictures and photographs of the different wounds, you will see that these are not just a hole. These actually create a much more visible and much more graphic a trauma. All right, in this case they're gonna be opening. In this case it's much more likely to need surgery. They're gonna be opening it, cleaning it well, and doing something about this bone, maybe using some prosthetics, something to fix the bone itself. It's not going to be treated as an ordinary fracture. In both of these cases, antibiotics are important because of the infection that comes with this sort of wound, right? Just the main difference between these two. So yeah, it is very different from getting shot with handgun and then with a rifle. That being said, depending on where you got hit in your body, there's a whole different ball game as well. Something I left from when we were talking about chest wounds, right? We have the guy here, we have the head, we have the guy's mouth, and we have the lungs, right? Lungs and heart over here. Now this works, the respiratory system works with the diaphragm contracting, right? Because of the vacuum created inside the chest, the lungs get filled with oxygen, with air, right? The air that flows inside because of that sucking movement made by the diaphragm, right? Now this depends a lot on that vacuum created. If there's a hole in your chest in some way, there's a problem, and that's what happens when you get shot in the chest. If we shot the guy here, for example, and we make another little graphic over here, we have, let's suppose this is the chest, these are the ribs, this is the space between the chest and this being the lung, right? Let's suppose this is the lung, one of the lungs, and this is the chest. If we make a hole here, what happens is that air starts going in through it, right? When the diaphragm goes down like that, right, instead of having a vacuum going on here, we have air flowing inside from the hole, right? What the name of it, I think this is the pleural space, I think it's called. It's espacio pleural in Spanish. I'm not so sure about it in English. Doesn't matter. The thing is that here you shouldn't have any air, and because of this hole, that's exactly what you have. You have air going in. So when this happens, when the diaphragm goes down like that, and you're trying to breathe, what happens is that air sips in and it starts filling here. Besides this, you will also have a bullet hole in your lungs, and all this is going to be bleeding. So you're going to be having both air and blood in the space where there should be nothing at all, just suction movement. So that's why they say that the lung will collapse. The lung, instead of being full of air, it's going to be turning into something, like a disinflated balloon, right? And that's also why they call it a sucking chest wound, right? Because this hole here, it's going to be, you will hear the air going through it, right, making a bit of bubbles as well. So that's why they call it a sucking chest wound. Usually the treatment for this, and this is extremely out of my range of my area of knowledge, but just so I have to give you an idea, one of the things they do is they implement a valve system using something that is called an Asherman chest seal, or just a 3-side bandage, or sometimes this is improvised with a piece of the bag of one of the medical kits that they come. They use it's like a piece of plastic about the size of a hand, and they just put tape on 3 of the sides and leave one open. So when you do that respiratory movement, when the diaphragm goes down, air doesn't come in. You know, it works like a valve, just shuts down, doesn't allow air to go inside. And when you go the other way around, it still allows air to come out, and blood and whatever needs to go out still does, but you have that valve. The Asherman chest seal is actually about the size of a CD, and it has a small rubber valve, right? And this valve makes that exact same function. It allows air to go out but not in. So that's basically it about the chest wounds you can consider. Of course, this entire area, and that's why when we practice shooting, here is where we aim. You have the head, you have the neck, and besides the complications that I've mentioned here, you also have blood vessels going up and down here. So getting shot in this area may compromise one of those blood vessels and cause very rapid internal bleeding. So maybe you just see an entry hole, a very small entry hole, maybe a bit of a bigger exit hole on the other side, but internally it may be bleeding very fast, and you know, the person goes down right away. You don't realize why, but because of that rapid loss of blood, the pressure dropped, and the person simply couldn't keep his footage, so he's gonna be going down because of that internal bleeding. You have the heart, you have many important things going on here. You also have the backbone as well, so if you hit the backbone even from the front, if it actually hits the backbone, again, it's going to be causing some major damage and major shock to the person. Remember the one I talked about, the person that got shot in the shoulder with a .45 ACP? This was an unarmed bad guy, and this other guy I talked to, he shot him with a .45, hitting him in the shoulder in this exact area. Because of the nerve that goes through here, it caused so much overwhelming pain being shot right there that this bad guy wasn't able to return fire at all. He just went down. In spite of being armed, he couldn't fight back. Okay. There's also so many complex parts going on in the body, depending also on the caliber that is being used. For example, 22 long rifle, which is extremely poor as a man-sharper, has the ability to travel a lot in the body because of these differences. Because you sometimes see the block of gelatin, and you see this graphic, the projectile that went in, but you're never going to be attacked by an evil block of ballistic gelatin. It's not very common. I haven't heard many stories of that. The villain block of jello, not very common. It's likely going to be someone with organs and bones and flesh and fat and organs with different textures and different stretch abilities. Some organs are more able to stretch than others. If you get shot in the liver with a hollow point, you're going to be in a world of trouble, because it's an organ that cannot stretch as fast as the passing bullet is requiring, right? So as it goes through, it's going to be causing lots of damage all along that organ. Something similar happens with your kidneys as well, which is extremely painful. Imagine, guys, that even getting punched in the kidneys knocks down a professional boxer. Imagine an average person getting shot through the kidneys as well. It's not the head, it's not the central nervous system, it's still the kidneys, and you still go down in spite of getting shot with a 22 in the kidneys. Very painful, works very well. You cannot be counting on it, but it just may happen. About the 22 long rifle, it travels. There's been cases of people that got shot in the arm, and it found the path of less resistance right through an artery or between the flesh and bone or the skin or something, and it travels inside through the armpit and has bad enough luck that it ends up in your heart or some other important organ, killing you because of a shot in a limb. Maybe getting shot in that arm with a .44 Magnum wouldn't have been fatal, but those are all the things we cannot control. About the lower the lower chest where you have the intestines and such, yeah, it's much better to get shot here than in the upper chest where your respiratory system is compromised right away. Now, here as well, you're in a world of trouble, because even one shot in your intestines may cause holes in different parts of that intestine, because it's all folded. That relative of mine that got shot like several times with a 9mm doing a robbery after going to an ATM, he was shot full of holes, and each of those holes in his belly, you know, went through several pieces of the intestine. So they have to cut you open, go through all this, fixing the holes or cutting the intestine that isn't good anymore, patching you up. It's a very complicated surgery, but you're still likely to survive. One little story more, and I'm gonna be letting you guys go. What bad guys do here, and this I've been told by one cop and a doctor that works in a prison, patching up criminals and such rather often. What criminals do, some of the more professional criminals do around here, is they don't eat for a couple of days before going to an important hit. If they think there's a chance of getting shot, you know, if they're going to be robbing a bank or something like that, they don't eat for 2 days. They purge their body for 2 days and make sure they have nothing in their intestines. Why? Because what kills you with a shot in the belly is not the shot itself. Most likely it's going to be the infection caused by the feces in your intestines spreading and infecting all your body, right? So they don't need anything. Their intestines are clean, and the shot goes right through. They just lay low for a few days and they're back up again. I've even heard of cases of bad guys getting shot, mostly with 9mm full metal jacket, getting shot in the chest. You know, it caused the pneumothorax that we talked about before here, the sucking chest wound. But since it's 9mm and it's full metal jacket, it doesn't cause that much damage inside. It just punches through, and with a bit of luck, these guys just survive. It's small enough that it shuts on its own, right? And they just make it. So, you know, one of those things normal people don't think much about purging, about going into and not eating anything for a couple of days so your intestines are clean in case you get shot. But these guys clearly do so. So folks, that's gonna be it for now. I hope you enjoy the final video, part 3 video of what happens when you get shot, and that you gather some more information so as to keep in mind and know what to expect if you ever get hurt yourself with a firearm, if you ever get attacked, or you have to use your firearm for self-defense. That's gonna be it for now, guys. Take care and see you on our next video. Bye bye.